It is quite reassuring that these days pregnant women with medical conditions such as neurological disorders can have safe pregnancies and healthy babies. Welcome to BirthVibe by BirthRight by Rainbow Hospitals, where we simplify pregnancy topics through conversations with experts to help families make decisions. I am Dr. Himabindu Annamaraju, consultant obstetrician and gynecologist at Rainbow Hospitals Financial Districts. Today we have with us Dr. Anitha, who is a consultant neurologist, to help us discuss neurological disorders in pregnancy. Welcome, Dr. Anitha.
It's a pleasure to be here.
When we talk about neurological conditions complicating pregnancy, what are the conditions you generally come across? What do you see in your clinical practice regularly?
We broadly see 5 groups: headache disorders, epileptic disorders, strokes, demyelinating disorders, neuromuscular conditions. Headache is most common presentation. It can be a part of previous migraine. Or new onset headaches can be underlying CSVT related, cerebrovenous sinus thrombosis related, or preeclampsia, or idiopathic intracranial hypertension, which are common during pregnancy. In seizure can be the presenting symptom of previous epileptic illness, or it can be new onset seizure because of underlying CSVT or PRES. So this is the next most common condition, which is very important, which we deal during pregnancy. And other conditions like stroke, which is rarely we see stroke, but it can happen. Stroke can be ischemic stroke, or it can be CSVT because of hypercoagulable state during pregnancy. Sometimes, rarely, hemorrhagic strokes also can happen. Demyelinating disorders, mostly we hear about multiple sclerosis, which can undergo remission during second and third trimester of pregnancy, but can relapse in postpartum 6 weeks of pregnancy, postpartum period. Other common neuromuscular conditions like carpal tunnel syndrome, myalgia paresthetica, Bell's palsy can occur during pregnancy most frequently because of the weight gain they achieve and because of the immune status changes during the pregnancy. And some rare conditions like myasthenia gravis, Guillain-Barré syndrome also, they can have relapses, remissions during pregnancy. Out of these, I commonly come across headaches and epilepsy, and new onset headache, which we need to be worried about for neurological complication like CSVT, PRES, or stroke. Whenever we come across new onset headache, we have to be evaluating this condition thoroughly.
So, in all of these multiple neurological conditions we discussed, can these women really have pregnancies? Are they safe to be pregnant?
Yes, they can have safe pregnancy, but planning is more important. Don't get panicked. So whenever a woman suffering with neurological conditions, like for example epilepsy, if they are planning for pregnancy, prior to they plan for pregnancy, they should consult neurologist, and they have to plan well before at least minimum 3 to 6 months before they conceive, because they are on anti-seizure medication, which can be unsafe, which can cause birth defects like valproate. So we may have to change the anti-seizure medicines to safe medication to prevent birth defects. During the time of pregnancy, if they develop seizure, that again poses risk to baby and mother. So need to be well controlled before planning for pregnancy, and they should be supplemented with high dose folic acid before they conceive. And for regarding other conditions like multiple sclerosis, we may have to time the disease modifying agents around the pregnancy. And for migraine individual, we have to counsel them about the lifestyle changes, because we can't go for anti-migraine medication during the pregnancy. And if they have any prior history of strokes, we need to evaluate for the risk factors, and we have to manage the risk factors well before the pregnancy. Like in this way, and with the obstetrician and neurologist reviews and follow-ups, if they can plan well before pregnancy, they can have safe without any complications during the pregnancy.
Exactly. We have managed many such cases together, right?
Yes.
More recently, we had a case of a woman with epilepsy. Her was good, had seen you before she conceived, and was on the right medication. And then when she was pregnant, we did close monitoring, had regular scans. We monitored her for blood pressures, because these women are also at risk of developing blood pressure issues and preeclampsia. And she had a completely normal pregnancy and a healthy baby at the end of it.
Yes. This is the most common scenario. Like a young 28-year-old woman who is prior history of epilepsy, who wants to conceive. They consult us before, well prior to the conceive, and we may have to adjust the safe anti-seizure medication like levetiracetam, lamotrigine, if they are already on anti-seizure medicines like valproate, which can cause birth defects, congenital malformations, and we adjust the medication dose with monitoring of their drug levels during this period, and they will plan the pregnancy with your guidance, the safe pregnancy period they achieve, and they can undergo normal vaginal delivery, and postpartum also they can breastfeed. Most of our patients achieved this.
Yes.
Safe journey during the pregnancy and postpartum, safe postpartum period they had. Then they had underwent breastfeeding also, which most of them think that breastfeeding is not safe during pregnancy with the anti-seizure medication with epilepsy.
So breastfeeding is quite safe, but only thing that we tend to advise a woman is, because there are hormonal changes after delivery, and with regular breastfeeding the woman can get exhausted. So sometimes that itself can trigger seizures. Yes. So we do warn them in the first 6 to 8 weeks after delivery to always have an adult with them at home. Be wary not to carry the baby if they're going up the stairs or down the stairs, and be cautious if they feel any symptoms that a seizure could occur. Obviously get help immediately.
And one lady had focal seizure during the pregnancy itself. We had managed with safe anti-seizure medication. She had no recurrence of seizure. She had normal pregnancy and normal delivery, safe delivery. In the same way, we had other neurological conditions also, like multiple sclerosis. One lady we had. Because her disease was very well under remission. We have stopped those disease-modifying agents which are unsafe for pregnancy. And then we are planning to restart her on anti-disease-modifying agents in the 3rd trimester. So she is doing well. And other mild conditions like Bell's palsy we had, where we have given short course of steroids and advice for physiotherapy. Then they did well. And most of them had carpal tunnel, neuralgia, with the proper control of their weight and proper lifestyle management. We had controlling their sugar levels. We had managed them well, and they are doing well. Out of all these, epilepsy is the most important condition which pregnant ladies and ladies before conceiving, they should know about. What are the things they have to do, and most of them have myths about their pregnancy. Their family members also, they worry about pregnancy, whether they'll conceive or not, whether they'll have normal baby or not. Whether they can continue the medication during the pregnancy. Most of them will abruptly stop the medication and come.
Which is actually more dangerous.
More dangerous than they worry about medication. But having seizure is more dangerous
than continuing the medication.
Because that can cause injuries in the mother, baby.
Correct.
Low oxygen levels in the baby, which can cause hypoxic injury in the baby. So that is even more dangerous.
So tell us a little bit more about how pregnancy can affect epilepsy.
As such, pregnancy will not change the course of epilepsy much. When they become pregnant, 1/3 of the cases, there can be increase in the frequency of seizures. In 1/3 of cases, there may not be any change. In 1/3 of the cases, occurrence may decrease. So only thing we worry about is because of their physiological changes they get during pregnancy. The blood volume increases, body weight increases, so they need more dose. We need to strictly monitor the drug levels and change the medication dose accordingly. And because they'll have decreased sleep, stress, anxiety about their pregnancy period and delivery, all these things can sometimes increase the seizure frequency. So with proper counseling and medication adjustment, we can tackle these things. Some anti-seizure medicines, we may not, like as I told you, anti-seizure medicines which are unsafe cannot be given, and we may have to change the anti-seizure medicines sometimes during the pregnancy itself. With close monitoring and reviewing the drug levels, we can put them on safer anti-seizure medicines. With proper counseling, repeated reviews with you and with the neurologist, we can monitor them and they can have safe pregnancy period. Epilepsy can affect the pregnancy course. How do you monitor those pregnant ladies with the epilepsy condition?
So women with epilepsy, like you said, if they come into the pregnancy in a well-planned state where they're on the right medications and the seizures are in control, generally the pregnancy outcomes are quite good. It's if they have unplanned pregnancies or they're on medications which are not safe to use, and we end up changing medications during the pregnancy, their risk of seizures during pregnancy will be higher. And if they have seizures in pregnancy, obviously it increases increases the risk to the fetus. So the baby can also be exposed to hypoxia, and if there are recurrent seizures, recurrent episodes of hypoxia for the baby, so risk of baby being growth restricted and being small for gestation age. Sometimes the mother is at a higher risk of having high blood pressure as well. Sometimes they're at risk of developing gestational diabetes as well. So all of these together will affect the growth of the baby. Risk of congenital defects and birth defects purely from epilepsy is not very common. They can be more drug related if they come into the pregnancy with not safe drugs, that is possible. But if they come into the pregnancy with good drugs which are safe, proven to be safe in pregnancy, generally they are not at a higher incidence of birth defects for the baby. So what we would do is make sure they are on the right drugs, and if they are, if the seizures are in control, then they would have regular screening for other medical conditions like blood pressures and blood sugars, thyroid, everything else, and they would have regular scans. So there'll be a first trimester scan, NT scan, then there'll be a 5th month anomaly scan to check for all the organ development, and then they have regular growth scans to make sure the baby is growing well according to the gestation. Once they get to term, these women can have a normal delivery if the condition is in control. So one of the triggers for seizure is pain. So pain control is quite important for these women. So we do counsel them about having an epidural during labor, and then the pain is in control, and then they are like any other woman who is in labor. Epilepsy does not affect their delivery mode of birth. So they can very safely have a vaginal delivery. And indication for a cesarean would not be epilepsy. It would be any other obstetric reason if needed.
Yes.
And after delivery, they'll have generally a normal postnatal period. Medication levels would be adjusted accordingly as per your advice. But they can breastfeed. They just need close monitoring to make sure they get enough rest and feel well. But they can have absolutely normal pregnancies.
Yeah, normal delivery except for the refractory seizures.
Correct. Yes, if they're uncontrolled.
ICP, intracranial pressure, then only we advise to.
Yes, correct.
And coming to congenital malformations, actually normally general population also 2 to 3% they can have congenital malformation. With the drugs it can double. That means only 4 to 6% it can increase.
Yes.
Especially valproate is the main drug which can cause neural tube defects.
Yes.
That is the only major congenital malformation. Sometimes other congenital malformations like small cleft lip, cleft palate, other renal malformations can be managed post-delivery.
Birth. Yes. And the neural tube defects are identified quite early on in pregnancy. So it can be identified and they can be counseled quite early on.
Correct.
Can pregnancy itself trigger new neurological conditions?
Sometimes, because so many physiological changes occur during pregnancy, like hormonal changes, immune changes can occur during pregnancy. Blood volume also increases. So this increases the hypercoagulable state. There can be increased risk for venous sinus thrombosis in the brain, or stroke risk can be increased. And even migraine frequency also can increase especially during the first trimester. And some of the immune conditions like multiple sclerosis, myasthenia gravis, they can go under remission during pregnancy, but postpartum they can relapse. So these conditions can occur newly during pregnancy.
Are there any warning signs that you would tell a woman or her family to never ignore and always seek medical help?
If there is any new neurological symptoms like severe headache, intractable headache associated with vomiting or visual disturbances, or any focal neurological symptom like sudden onset of speech difficulties, slurring of speech, deviation of mouth or facial weakness, or hand-leg weakness on one side, or sudden loss of balance while walking, sudden vision disturbance with either double vision or vision loss, change in the sensorium, mentation, some behavioral changes. All these things are alarming signs. They can indicate the underlying venous sinus thrombosis or stroke or press. So these cannot be ignored. Sometimes new onset seizures also cannot be ignored. It can be a sign of underlying venous sinus thrombosis or stroke or press. So whenever we see a pregnant lady with new onset any neurological symptom or increase in or change in the headache pattern, if they have any migraine history before or intractable seizures, they cannot be ignored and they should be evaluated for these underlying causes and should be managed well to prevent further complications.
So if any woman with such neurological conditions gets pregnant, do you think it is safe for her to have a pregnancy in remote settings, or what would you advise? Which kind of place should she be cared for?
It's better to have, with especially women with neurological conditions, they better to have pregnancy monitoring and delivery in the tertiary care setting where multidisciplinary team is available under one roof. Like a neurologist who takes care of medication safety. Obstetrician who takes care of the baby's growth and planning, timing of the pregnancy and which method of delivery, timing of the delivery, and intensivist who steps in whenever there is seizures, eclampsia or press or any other neurological seizures, intractable seizure status if it is there, the availability of intensive care unit, neurological care, MRI availability, anesthesia, who plans for general anesthesia, spinal anesthesia depending on the situation. So with the multidisciplinary care, the tertiary care center which has all these facilities, we advise them to go for delivery and pregnancy monitoring, especially when they have neurological conditions. Like sometimes multiple sclerosis and myasthenia gravis also can flare up. So that they may need proper respiratory care, ventilator facility. In those situations, better to have pregnancy care in the tertiary setup with all these facilities under one roof. What type of facilities do you advise them to go for delivery?
So similar to what you said, similar to how their care should be for pregnancy in a multidisciplinary unit, delivery also needs to happen in a multidisciplinary center. So they need to be in a labor room where both the mother and the baby can be monitored quite closely, because in labor sometimes seizures can be triggered. So there needs to be an obstetrician who is aware of the condition and knows how to manage, an anesthetist who can give them the right treatment to stabilize if a seizure happens in labor. Sometimes they're at risk of having a preterm delivery. So we need a neonatal specialist also who can handle a preterm baby, and facilities for a neonatal ICU, similarly facilities for a maternal ICU. So all of these need to be present when a woman with a neurological condition plans a delivery. So tertiary centers are always the best place because we work as a multidisciplinary team, and then we can coordinate and achieve best possible outcomes for the mother and the baby. Let's discuss some myths now. So women with epilepsy cannot get married. Myth or fact?
It's a myth. With epilepsy or any other neurological condition, they can get married.
So women with epilepsy cannot have pregnancy?
They can have pregnancy, even with epilepsy, neurological condition, neurological disorder. With the proper planning, care, monitoring, they can have pregnancy, delivery, normal delivery.
And medications, anti-seizure medications, should not be used in pregnancy.
It's a myth. Only few anti-seizure medication are unsafe during pregnancy, but with proper change of medication to safe medication, they can continue the medication even during the pregnancy. Epileptic patients, they don't have normal babies. Is it a myth or fact?
That's a myth, because they have completely normal babies and risk of birth defects is comparable with normal population.
They cannot have normal delivery. Is it a myth or fact?
That is also a myth, because with well-controlled epilepsy, with modern analgesia like epidurals, they can have absolutely normal deliveries.
And most of them think that they cannot breastfeed while on medication, especially epileptic patients. They cannot breastfeed when they are on these medication or any other neurological condition with the medicines. They cannot breastfeed the baby. Is it a myth or fact?
That is also a myth, because these medications don't really transfer in the breast milk. So the baby is not affected by them. So it's very safe to breastfeed while on these medications. Any final message that you would like to tell our viewers?
The neurological conditions during pregnancy, it is not impossible pregnancy. They can have normal pregnancy, normal delivery, safe postpartum period with planning, proper monitoring, regular follow-ups. So they can have with proper care by multidisciplinary care. So talk to your neurologist before you conceive. If you well plan it, you can have normal pregnancy period and delivery without any complications.
Thank you, Dr. Anitha, for your very informative and insightful discussion. At BirthRight by Rainbow Hospitals, we manage complex pregnancies collaboratively along with our multidisciplinary team, including our neurologists, medical specialists, intensivists, anesthetists, and fetal medicine doctors. And we make sure that every woman gets the right care and they have the best possible outcomes for the mother and for the baby. Thank you.